Let's start on the very disturbing story. The French writer Jean-Baptiste Alphonse Karr was a former teacher in the 19th century. He coined the phrase plus ça change, plus c'est la même chose, which means the more things change, the more things remain the same. The failure of public administration in Victoria gets worse and worse. If the Victorian government were a private sector entity, the whole board, in this case the Cabinet and the Premier, would be sacked. It is past excuses, and all Australians are bearing the cost. The Victorian lockdown is costing the tourism industry $146 million a week. What's it costing our young kids? 700,000 have been told to stay at home, to learn. What is the cost to the nation of this staggering incompetence? The economy of Victoria, which has been ground to a halt, would normally account for 23% of Australia's gross domestic product. Yet, what Victorians and the nation face is a simple and direct consequence of the Victorian government's failure to administer hotel quarantine properly. So the virus has spread into the community and spiralled out of control. We're not told how many of the cases are mild or how many are critical, but out of more than 1.5 million test results in Victoria, 46 patients are in intensive care, 195 are in hospital, and there have been 77 deaths. We don't know their ages. The vast majority of deaths in Victoria, we're told, are of people over the age of 90. Yet when a man in his 40s died at the weekend, instead of giving us details as to whether the man had any preconditions, the Andrews alarmism continued. This doesn't discriminate on age. Well, why don't you give us a breakdown? Can't we be told the ages of those who've died? Can't we be told whether these people died from coronavirus or with it? We have today 161 deaths in Australia, 126 of them in Victoria and New South Wales combined, 126. But last year, over 900 Australians died from the flu. The issue here is not just coronavirus, but rank incompetence on two fronts. First, the federal government offered Andrews up to 1,000 experienced Defence Force personnel to oversee the arrival of travellers from overseas and their enforced isolation for 14 days. Andrews initially accepted the offer. Then he declined it, leaving quarantine in the hands of private contractors, presumably Labor mates. What we're seeing in Victoria is the failure of hotel quarantine, with security staff spreading the virus into the community. They were not subject to effective supervision by the Victorian Health Department, and Commonwealth authorities were excluded from any role. Fancy hotel guards sleeping with guests, shaking hands and sharing lifts with people in quarantine. Quarantine families moving between rooms. Now over 30 Melbourne suburbs are in lockdown, 5 million people. And Andrews blames lockdown fatigue. Rubbish. This is unprecedented government failure. Mr Andrews can't manage, and he can't tell the truth either. There's a wider issue here beyond this. It is 3 months since Sydney's Newmarch nursing home claimed 17 lives. What has the Andrews government learned? Absolutely nothing. This is also a failure of the so-called National Cabinet, by the way. Remember, we're all Melburnians now, really? Instead of standing Daniel Andrews up and reading him the Riot Act, after all, a stack of his government funding comes from the Commonwealth, Andrews travels merrily along, exhibiting every day further consequences of his incompetence. Victoria's nursing homes are now facing a devastating outbreak. And because they house the elderly, tragically, there will be deaths. There were 10 deaths on Sunday alone, and now 683 active cases linked to aged care in Victoria. It's a staggering indictment of failure. Relatives of residents at Heritage Care's Epping Gardens facility in Melbourne's north were told on Sunday that 83 cases, including 61 residents and 22 staff members, have now been linked to the home. Other aged care clusters include 82 cases linked to Estia Health in Ardea, that's Melbourne's west, 78 cases linked to St Basil's Homes for the Aged in Fawkner, Melbourne's north, 52 cases linked to the Glendale Aged Care Facility in Werribee, Melbourne's outer southwest, 48 cases linked to Estia Health in Heidelberg, in Melbourne's northeast, 39 cases linked to R-Care Aged Care in Craigieburn, that's in Melbourne's outer north, 27 cases linked to Aram Aged Care in Plenty, that's in Melbourne's outer northeast, 25 cases linked to Regis Aged Care in Bayside Brighton in the southeast, 19 cases linked to Kirk Bray Presbyterian Homes in Kilsyth, that's in Melbourne's outer east, 11 linked to Outlook Gardens Aged Care in Dandenong North, that's in Melbourne's outer southeast. 9 cases have been linked to Craigie Care Aged Care Facility in Pascoe Vale in Melbourne's northwest. And I have to say, the Commonwealth are not off the hook here. There are $50 billion worth of residential aged care facilities in Australia, and the amount of capital contributed by the federal government is virtually nil. On any given day, there are approximately 2,700 aged care homes in Australia, 189,000 residents, 873 aged care providers, over 300,000 employees. Now, these poor residents pay in the belief that there'll be dignity in old age. And here, in the middle of this coronavirus, when the Prime Minister said on March 15, and I quote, "For older Australians and those who are more vulnerable, it's a far more serious virus. Our aim in all of this is to protect the most vulnerable, the most at risk." That has not happened. It's clear none of the lessons from Sydney's Newmarch nursing home have been learnt. It's clear the Andrews government and governments generally have not supported these nursing homes with personal protective equipment, appropriate staffing, COVID testing, hospital transfers. There were emergency talks on Friday night, but that's all it is. They just talk. Families of residents at the worst-hit facility, St Basil's Home for the Aged, were evacuated, but families have been left in the dark about the fate of their loved ones. One report said dozens of bags containing hazardous material are piled high outside the home. According to one report today in the Australian newspaper, quote, "In a corner of the facility, yellow garbage bags of medical waste littered the ground beneath an overflowing bin." My understanding is some providers, and as I've said, there are about 873 aged care providers across the country, some providers sent residents to hospital only for them to be refused admission. In other words, if the hospital hasn't had an outbreak, these poor people are turned around and sent back. Understandably, many aged care workers are either COVID positive or in quarantine because they were exposed while working in a nursing home. So there are significant staff shortages. There is clearly no plan to make sure there are adequate staff, no plan to bring staff from interstate or even use the military. Some reports suggest, understandably, that care workers can't afford to miss shifts if they become ill. And many may be asymptomatic, which means they don't know they're carrying the virus. Many blame the federal government, which is the level of government responsible for aged care. There's currently a royal commission into the aged care fiasco, not before time. Aged care providers' efforts to train care workers in pandemic control measures are woefully inadequate. Now, you and I, in all of this, would be regarded as simpletons. Why couldn't all positive nursing home residents be moved to vacant centres, set up as COVID wards? I understand that proposal's been ignored. Many of these residents are old and frail. They need high levels of clinical care. Many never have a visitor, so they need staff just to spend time with them. This is expensive. A skilled workforce is needed to give dignity and decency in old age, but there is inadequate public funding made available for that. One day, we might be one of these people. It could be us, our mother, our father, our sister, our brother, or our dearest friend. Paradoxically, coronavirus has given us the lesson we need. We pay government via taxes to make life better for everyone. What we're now learning is that through incompetence and indifference, thousands of older Australians are being betrayed.